In today's webinar, we will briefly review some concepts related to sexuality, gender identity, and gender expression, discuss cultural humility as a framework for providing healthcare and social services, and hear directly from youth and healthcare providers on how best to engage with cultural humility practices when working with LGBTQ youth. We're going to start with some basics just so that we're all on the same page. If you haven't heard of these terms and concepts before, this is a great place to start. And if you're well versed in this area, it's always helpful to take time for a quick review. First, what do we mean by LGBTQ? LGBTQ is an acronym for lesbian, gay, bisexual, transgender, queer or questioning, and others. The plus can include people who identify as asexual, androgynous, intersex, or demisexual, among many other sexual orientation and gender identities. It refers to a population of people who are sexual and or gender minorities. So let's get started by talking about sexuality. Sexuality is often thought about as having three main components. These are attraction, behavior, and identity. These components of sexuality include who an individual is romantically, emotionally, or sexually attracted to, which sexual behaviors an individual engages in and with whom, and how that individual identifies and possibly labels themselves in terms of their sexual orientation identity. Attraction, behavior, and identity may interact or overlap in different ways for different people. But what does that mean exactly? This can mean that an individual's sexual orientation identity is a direct reflection of who that individual is romantically, emotionally, or sexually attracted to, and who they engage in sexual behaviors with. This could also mean that an individual's sexual orientation identity label is a reflection of how that individual sees themselves, and also that they are attracted to and or are engaging in sexual behaviors with people who do not fall within that sexual identity label. This is an important distinction when discussing sexual health with patients, so that we are not making assumptions about their sexual behavior based solely on their sexual orientation identity. Sexuality can be fluid, meaning that someone's attractions, behaviors, and identities may change throughout their lifetime. So we also don't want to assume that these will always remain the same. Let's take a minute to explore the identity piece further and discuss some culturally appropriate terms for talking about LGBTQ youth. Right now, we'll focus on sexual orientation identity and then on gender identity next. Lesbian and gay identity labels are commonly used by people who are emotionally, romantically, or sexually attracted to people of their same gender. Bisexual is commonly used by people who are emotionally, romantically, or sexually attracted to both people of their same gender and another gender. This identity label does not indicate or require a level of interest that is the same across both genders an individual may be attracted to. Queer is used in a variety of ways. It functions as an umbrella term for some LGBTQ people to refer to all non-heterosexual identities, also as an alternative and sometimes intentionally vague sexual orientation identity, as well as being used politically. It is important to note that the word queer is offensive to some and is generally seen as an in-group term to be used only by LGBTQ people. Questioning is used by some to indicate the process of exploring and discovering their sexual orientation identity. There are many other sexual orientation identity labels that individuals may use, including but not limited to pansexual, asexual, same-gender loving, aromantic, demisexual, and homosexual. Note that homosexual is considered a stigmatizing term by many, but some people still use this identity label for themselves. Now let's talk about gender. When we're thinking and talking about gender, there are several things we need to keep in mind. First and foremost, gender and sexuality are not one and the same. People have both a sexual orientation identity and a gender identity, and these are related in some ways, but are two distinct components of a person's identity. Gender identity is a person's internal, deeply felt sense of their own gender, be it female, male, both, neither, or any other gender. Everyone has the right to define their own gender identity labels. An individual's gender identity may or may not correspond with their sex assigned at birth. Sex assigned at birth refers to the sex that is listed on a person's original birth certificate. Sex assignment is most often based solely on physical genitalia present at birth. Gender identity and sex assigned at birth are both different from gender expression. Gender expression refers to the external manifestation of a person's gender identity, which may or may not conform to the socially defined behaviors and external characteristics that are commonly referred to as either masculine or feminine. Gender expression may include things like the way someone dresses, their hairstyle, the way they carry themselves, their mannerisms, their physical characteristics, the way they speak, and their social interactions, among many other things. Cisgender is a term used for people whose gender identity does not differ from the sex they were assigned at birth. Transgender or trans is an umbrella term used for people whose gender identity or gender expression differs from the sex they were assigned at birth. Sometimes, trans with an asterisk is used to denote that the term is being used as a broad, inclusive category. Since it is an umbrella term, not all people whose gender identity or expression differs from their sex assigned at birth identify as transgender. For example, the term transgender could include someone whose sex assigned at birth was male, but who does not identify as male. This person might identify as female, a woman, a transgender or trans woman, gender nonconforming, non-binary, genderqueer, or any other gender identity they feel most comfortable with. Again, this is different from a person's gender expression. Both transgender and cisgender people can express their gender in ways that may or may not conform to our socially constructed ideas of masculinity and femininity. We often call this gender nonconforming. So we already know that some people do not identify with the sex they were assigned at birth. And we know that the word transgender is commonly used when talking about these people. However, transgender is only one of a limitless number of gender identities that a person could have. We mentioned earlier that we use the term gender nonconforming to talk about gender expression, but it is also a gender identity. A lot of people also have non-binary gender identities. This means that they don't identify within the socially constructed dichotomy of male and female. People who identify as non-binary might use non-binary as their identity label. They might also use other gender identity labels such as genderqueer, genderfuck, neutrois or neutrois, neither, gender fluid, agender, bigender, genderless, or androgynous, to name just a few. Identifying outside of the gender binary is becoming more common among youth, so this is especially important to be aware of when working with youth populations. When someone's gender identity differs from the sex they were assigned at birth, some transgender, gender nonconforming, and non-binary people make changes to affirm their gender, which we call gender affirmation. Gender affirmation, sometimes referred to as transitioning, can greatly improve a transgender person's mental health and overall well-being. There are many things people can do to affirm their gender. These can be described as primarily falling into three categories: social, legal, and physical. Social gender affirmation can include changing the name and pronouns that someone uses for themselves, changing the way they dress, or changing the way they behave in social interactions. Legal gender affirmation includes things such as making legal changes to one's name and gender marker on identity documents. Physical gender affirmation can include both medical and non-medical physical changes. Medical gender affirmation includes things such as hormones, surgery, and silicone injections. It is important to recognize that not all transgender, gender nonconforming, or non-binary people will make gender-affirming changes. These are simply some of the ways that people might affirm their gender, but there is no right or wrong way to do so. Lastly, people may identify or express their gender differently in different situations or at different times in their lives. Similar to sexuality, gender can also be fluid. This means that people may use different gender identity labels, names, and pronouns at various times or around different people. They may also change the ways in which they express their gender over time and in different settings. Gender fluidity does not in any way invalidate a person's gender identity. Language around gender identity and gender expression is constantly evolving and can change quickly. This can make it difficult for providers who are working with transgender, gender nonconforming, and non-binary youth to always be sure they are using culturally appropriate language. The best way to be sure that you are using appropriate language is to ask the youth you are working with. Not all gender minority youth use the same language to describe their gender identity and expression, and so what is affirming for one person may not be for another. Please note that the gender-related terms and identities presented in today's webinar are by no means an exhaustive list. This brief introduction to sexuality and gender is simply that, an introduction. Continually educating yourself by reviewing additional resources on LGBTQ+ communities is a great way to engage with cultural humility, which we'll talk about next. Now that we have a better understanding of sexuality, gender identity, and gender expression, as well as some language to use when discussing these things, we're going to shift focus again and talk about providing culturally appropriate care to LGBTQ youth. Many people are familiar with the phrase cultural competence. Cultural competency focuses on understanding the importance of social and cultural influences on people's health beliefs and behaviors, and considering how these factors influence a person's experiences. It is incredibly important to take these things into consideration when working with all patients. However, cultural competencies focus on understanding how social and cultural influences affect health is limited in its scope and adaptability as it focuses on a specific knowledge set that can be applied to all individuals in a social or cultural group. Having familiarity with social and cultural influences is essential to working with a diverse group of patients, but we can never be proficient or competent in another person's social or cultural experiences. We'd like to introduce another framework for providing culturally appropriate care that engages providers in processes of self-reflection and lifelong learning, called cultural humility. Cultural humility is a process in which individuals engage in self-reflection and self-critique as lifelong learners and reflective practitioners who develop and maintain respectful partnerships with clients and patients. Cultural humility is the ability to conduct yourself with other people in a way that centers the parts of that person's cultural identity they deem are most important. Cultural humility is a lifelong commitment to self-evaluation and self-reflection. It is also a desire to fix power imbalances and includes developing partnerships with people and groups who advocate for others. Cultural humility recognizes that individuals' and communities' needs change over time, so one-time trainings could never be enough. Cultural humility differs from other culturally based training frameworks because it focuses on self-reflection and lifelong learning rather than achieving a state of knowledge. But what does this really mean? We talked with some healthcare providers who work with LGBTQ youth about what cultural humility means to them and how they engage in cultural humility practices in their everyday interactions with patients. We also spoke with LGBTQ youth about their experiences accessing and receiving healthcare services and their recommendations for providers and staff working with LGBTQ youth. Let's take a look at what they had to say.
Cultural humility to me means approaching each of my patients as an individual with a unique set of experiences that I may or may not understand fully. I recognize that my background is really different than a lot of the people that I take care of, and there's nothing I can do to change that. So with that kind of background, the fact that we come from such different places, the only way I can really relate to them is to recognize those differences and to do my best to learn about their experiences and go from there. I'm not going to know everything, but I can get to know them as individuals and learn more about their background.
And I think cultural humility is really understanding who you are, for starters, and trying to come to grips with potentially what you don't know about a bunch of other people, and being able to walk into a room with any given client or patient and being there for them as a human being and appreciating all the little parts about them that make them unique.
Prior to becoming involved in this project, I was not familiar with the term cultural humility or the concept. When I was in medical school more than 20 years ago, we were taught cultural competence. And to be honest, cultural competence to me was a very stressful concept. It required me to know an awful lot, to me, in my mind, too many things that were unknowable. And it put a lot of pressure on me to be the expert in everything. The idea of cultural humility that only requires me to be willing to ask questions and to learn and to acknowledge when I don't know something is a wonderful thing. It was actually a relief to think that cultural humility is an adequate tool for me to have as a practitioner, a medical provider. So I'm looking forward to using cultural humility as a framework moving forward.
I don't think I've had any good experiences. I've had times where nothing eventful happens at any sort of at a at different appointments, but yeah, I don't know. Mostly my interactions with my doctors have been just sort of nothing or negative.
Because these are akin to traumatic experiences. It's like when you want to go back to a dentist, because it's not that the dentist did a bad job. It's just it's so freaking hard and it's so traumatic. So we go to these doctors because you have to remember people are dealing with anxieties and stuff. It's so off-putting. It's like, man, I'm not following up with that person. Even when you have to, it's just so uncomfortable because you don't want to be a burden to them, or you're trying to be respectful, not be a burden to them. At the same time, it was a bad situation for you because I guess I could always ask for another doctor, but it's just too much work. And if you're what I'm going off of, I just assume that I'm not going to get any better than that, and just cut that part down, cut it off. It's a waste of time, it feels like sometimes. Yeah.
It is just hard navigating medical spaces with people who don't exactly understand a lot of things and concepts, and just kind of insert their own ideas. Because it's I don't know, when I was talking to my psychiatrist, there was just nowhere I could meet her at, and that created a big divide. And thinking what should I do about this? Should I go to another psychiatrist? But will that psychiatrist be any better? So just navigating the quality of care is very troublesome when you have a non-hetero identity or a non-traditional gender identity. I think that's a part of finding good healthcare, unfortunately, for LGBT folks, is not exactly knowing if you will have the best quality care and best quality interactions.
I always feel incredibly hostile towards any comments that any doctor makes, really, just because of the history that the medical field has had with trans misogyny.
As far as being a transgendered feminine person, they don't assume that which I think I would tolerate more. It would still kind of suck, but I would tolerate it more if they would assume that they would respect the femininity instead of just assuming that I'm just this all masculine person. But I think that just comes with that lack of self education. It's not that I don't expect people to make mistakes. It's just when you make them, correct them. The ones who correct a mistake, that gives me hope, and then I can okay, well, she was trying. I'll give her another chance, and And it starts their process. You're not just on autopilot.
You cannot do human being work without constantly reflecting. I mean, every day I learn about a new culture. I'm like, really? Wow, that is fascinating. Okay. Because if you don't do the cultural humility work and you walk in and you make one of those assumptions, you just lost the patient. If you didn't lose them all the way, they're semi not trusting you. No, you didn't do that piece. And you can make a mistake, say with pronouns or whatever, and say, oh, I apologize. That's an in-process learning kind of a thing. But if you're not doing that work, like, why are you even doing this? I'm just saying, why are you even doing this? Because it's not just about the LGBTQ community. It's about all the communities of the world, because we're all a part of them, basically. Even though we may not be living and actively happening in one community, we're still a part of them.
But to really recognize that we live in a culture that devalues the lives and the health of certain groups of people, and as somebody who cares about the health of these groups of people, I really need to recognize those forces that are at play.
Everyone deserves to be treated with respect. Everyone deserves to be treated with compassion. Everyone deserves to receive the very best care that I can give them. At the same time, no two people can be treated the same way, because no two people are even remotely alike. So while everyone deserves respect, everyone also deserves an absolutely individualized interaction, because even if they look the same on paper, they're not the same person. They have different needs.
Treating everyone the same in theory is great. But we live in a world that does not treat everybody the same. And patients who identify as LGBTQ experience rejection, stigma, open discrimination, veiled discrimination. There's just a lot of things kind of out in the world that can have negative impacts on their life and their overall health outcomes. And so to kind of exist in that space out in the world and then come into a healthcare environment and not have those experiences recognized by their provider, I think is we're really doing them a disservice. To act like their experience in the world is the same as everyone else is I think, naive and is failing to recognize their lived reality. And so I think it's incredibly important to actually let go of the idea that we should be treating everyone the same, because, again, we live in a world that doesn't treat them the same, and we need to recognize that and be open about that.
I think what I liked about them is the fact that they were able to personalize their service to the person, and they weren't afraid to do that, and they didn't feel burdened by doing that. And in fact, I think they prided themselves on it because it made them feel like a more confident provider.
Again, really just trying to tune into where they're at and really what their desires are for their health is a big focus of the conversations, and less about where I think they should be going with their health.
And I think the only real difference I can draw out when I'm thinking specifically about working with LGBTQ plus youth is it's vitally important to let that youth know that whatever their identity, their orientation, their gender expression, that you aren't going to judge them, that you are a safe person, that this is a safe space. Until you've established that trust, they're not going to be able to tell you any of the things that you need to know to be able to help them with whatever it is that they need help with.
When we go into the room together and I'm meeting you for the first time, I just want you to be comfortable. So I'm doing anything I can do to make that happen and to start to work at building trust. Because I think that that's a huge piece right there. But I'm just myself. I think, to be honest, one of the best compliments I ever got was thanks for keeping it real. And so all I can do is be myself. I adjust my language for whatever the client or patient comes in with. Be ready to validate and affirm anybody in the LGBTQ spectrum's horrible experience that they had in another provider's office.
You know, as a result of maybe kind of social rejection that they've experienced are maybe in a different place, right? So I guess in terms of where someone is, in terms of their own feelings of affirmation and feeling really good about where they're at, and then where their surrounding environments are, for every young person, it's different. And again, the journey is really figuring out where they are and what they're going to need to feel safer and more supported.
Why not take just a few moments in those 10 minutes that you have to sit there and ask that client or patient to tell them a little bit about their story? And yeah, you don't have time or whatever, but you do. Because that 5 minutes or 10 minutes that you get that you're allowing that patient to tell their story and connect with you is worth $1 million, not only for you, but especially for them.
I would just ask that healthcare providers trust the experiences and inputs of their patients and not try to make decisions for the patients, but alongside the patients, just so the patient could feel comfortable and in control and knowledgeable.
People are experts in themselves. Trans people are experts in themselves. Queer people are experts in themselves, and you should listen to that expertise, just like you should trust us to listen to your expertise as a medical doctor. So when you're dealing with queer and trans patients, listen to them. What is your trans patient saying? What do they need? What do they need from you to in order to get the treatment they need and adhere to it? And other than that, what do they need from you just to simply be comfortable coming in and seeing you?
Just because someone identifies, for example, as a gay man doesn't mean that he engages in any particular behaviors. Likewise, just because someone identifies as a straight man doesn't mean that he doesn't engage in particular behaviors that stereotypically might be considered something that is more prevalent in the LGBT community. So I think being aware that asking about identity is important and orientation is important, but not making assumptions about what that means for what kind of medical care is necessary. When I'm thinking about the transgender community, the most important assumption that we make frequently that I think is a huge mistake is the assumptions that we make about the kind of transition that people want to make. Some people want to have dramatic transitions that involve surgeries. Many people do not. Some people want to take hormones. Many people do not. Some people's social transition doesn't even look like the social transition you might be expecting them to make if you were making an assumption about what their transition is going to be. So not making an assumption about what they want, rather asking them, and also not making assumptions about what they may have done already without clarifying that by asking them. The other thing that I'm fearful about as I get older is that when we're not engaging in some form of cultural humility, that we may really not be providing very good care. If we're making assumptions about our patients and are too uncomfortable to ask the patients we need to ask the questions that we need to know the answers to, we're not going to be able to make sure that we're fulfilling the needs that they have.
If we're talking about LGBTQ youth, then I don't think you can make any assumptions about anything. And I think that's hard for a lot of practitioners who are on, we're like, and especially MDs, they're on a very tight schedule. They get 10 minutes with the patient and so blah, 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 blah. And then floop, that assumptive thing happens and then the person's either going to tell you about it or they're not. And then if they don't tell you about it, they may never be back in your office again. So I know that seems like an easy answer, don't assume anything, but I'm just saying, don't assume anything. I don't want my assumptions to get in the way of them further disclosing any kind of important information to me.
there needs to be some recognition that queer and trans people might need a little bit more attention, or at the very least, you know, they need you to put your assumptions about how you treat other patients aside for them. Like, you need to listen to what they say, especially in terms of who they are, their gender and their body, and very personal things such as that.
And we really do have to cast our assumptions aside and be able to meet the person head on for who they are. And sometimes that takes work. And sometimes you have to go home at night and or talk with a therapist or your partner, whoever you have, to kind of go, wow, I had all these preconceived notions about what I thought XYZ was or whatever. And why did I have that?
I developed very early on the habit of reflecting on every visit as soon as I can after it's happened. If I have a half-day clinic, I like to walk or drive somewhere immediately after the clinic is done and literally go through each visit in my mind. If I am not able to do that, in the process of charting, I think through, oh, when they said that, I said this. Oh, maybe that wasn't the best thing to say. And I'm teased sometimes. Other providers will say, you live through every clinical encounter twice. But I don't know how I'm going to improve the way I interact with people unless I do that. I've even been known to call patients back in the afternoon and say, you know, I said this horrible thing this morning and I'm so sorry. I hope we're okay. It's not hard to do. You just have to make the space to do it, because I do it when I'm walking or driving. I don't need to make any extra time. I just have to turn the radio off and make the effort. But I think it makes the way that I interact with my patients infinitely better. And it decreases the likelihood that once I've made a mistake, that I'm going to make that same mistake again, because I will have thought it through. And it also gives me a chance to make things right when I realize later that I made a mistake.
The first thing I need to recognize is that by having grown up in this world, those are biases and forces that have implanted, and affected me as a provider. So to act like I can somehow rise above all of those things in my day-to-day interactions, I think is unrealistic, and also, fails to recognize my own humanity and my own mistakes that I make. So I think that's like the very first step when we're talking about assumptions or biases, is just recognizing that as much work as I've done and all the things I've tried to do to kind of deconstruct those biases, they're still there. And I still grew up the way I grew up and got the messages that I got, and that I really need to be cognizant and aware that they're gonna manifest in my patient encounters. Obviously, I'm gonna do my best to not kind of let them shape how I treat patients, but I need to be aware that they're there, and then really be able to kind of name them when they're coming up.
But it's not that I spend so much time educating them, is that their lack of knowledge was so blatantly obvious. Like, you could definitely tell somebody that knows what they're talking about, or at least cares enough to want to know, versus somebody that's just like, okay, whatever. Just take this medicine to get out of the office. You could definitely tell the difference.
And I know we all feel nervous about trying on something new for size, for sure. Like, how am I going to do this? Am I going to screw up today? But, you just got to put your best foot forward, and it's just going to get easier and better every day. Just like working with any community.
I don't think it takes any extra time to engage in cultural humility practices. Indeed, it makes things easier. If you as a provider are looking at your patient and trying to figure out all the myriad of things that you think you need to know, how much easier just to ask them. Or if they ask something of you and you don't know the answer, it's so much easier to say, I don't know, and I'll either find out or help you find someone who knows the answer, than it is to try to make something up. So I'm not sure it takes any extra time.
To be honest, I'll go on and say I don't think going to one diversity training, honestly, is enough. I don't think you can ever have enough. One is not enough.
So that first step is just putting in the time to actually get just the information. And then The second piece is putting it into practice with actually all of our patients, right? We can't be expected to try to like guess which one of our patients may be lesbian, gay, bisexual, will have a different gender identity than we're assuming. And so bringing up those issues with all of our patients is a great way to start. And to really say that up front, to say, I'm still working on my understanding of this, and so I want to be a supportive provider. Your health is really important to me, and so I'm going to ask you some questions. And I apologize if I mess up the wording. Feel free to give me feedback. I just think, especially with adolescents and young adults, they love giving feedback. They will let you know. And if you're really upfront about the fact that you want to improve your skills as a provider, most of the folks that I've worked with have been really open and actually excited about that.
One of the things I like about my current provider is she keeps like trans stuff, LGBT stuff that's going on in the community. Like she keeps it on the board in the office. And when I see that, I automatically know that, okay, this part of my identity is going to be supported here. Not just this masculine part, but also this feminine part. And just walking into an office and seeing those things is very comforting. It's that first impression, and she gives a good first impression. So I would tell doctors to give a good first impression, even if you have it's like a LGBTQ plus related magazine, sitting around, so they can know that you're aware that this identity exists, and you're not ignoring it.
You can start with your physical space. Anything you can do to signal to youth that you are an LGBTQ friendly space is important to do, whether that's hanging a rainbow flag, having a triangle sticker on your door, some symbol that the youth are going to recognize that lets them know they're welcome. We try to have a variety of reading material that will appeal to youth across the gender and sexual orientation spectrum.
As far as, what we would do as far as preparing for the day was making sure that I like to instill the idea of we're getting ready to throw a party every day, and not like a crazy party. I'm talking just like getting the clinic ready, and we've got fresh water, we've got some tea, and we've got, and we're welcoming everybody. We're no matter who you are, where you come from, your culture, your identity, whatever it might be, we're like, hey, welcome, Not
necessarily like doing streamers and confetti, but kind of metaphorically we are, because, again, in a world that maybe has sent them messages that their lives are less valuable, or the way that they choose to love other people is less valuable, or who they really are on the inside is less valuable, in a world that is sending them those messages, for them to even show up to address their healthcare is such an incredible first step, and really deserves celebration and support. And so, the first thing I'll say to patients is, I'm so happy you're here. You should be so proud of yourself for showing up today.
Yeah, and just like inclusive paperwork and inclusive like electronic information systems.
For front desk people, get used to just referring to everyone that you don't know as they, with like they as the pronoun. And like, if you don't already have like stuff at your work that's asks specifically what are your preferred pronouns, like getting that on paperwork is a good idea, and making sure that's like a thing that you have on file for every patient. And it has to be like every patient, because it can't be just like only for the trans patients.
Again, just recognizing that even the act of showing up is a step in the right direction and deserves praise and positive feedback. Again, from the front desk staff to the person who rooms the patient to the provider, all of us can offer that type of positive reinforcement and affirmation.
So when I'm asked to give providers advice about working with LGBTQ youth, in particular transgender youth, the first thing I always tell them is take a deep breath and remember that the person you're working with or about to go see in that examining room is just a person. absolutely nothing more or nothing less, just another human being. And if you can remember that this is just a person and you're going to have a human interaction, it's going to go so much better. You're going to be more calm. The patient is going to be able to see that you're calm and not frightened, and the experience will go better. I'm hoping that as we move forward, more and more providers will realize that not only just working in a primary care sense with transgender youth doesn't have to be scary, but actually providing healthcare for transition isn't very scary either. There are plenty of people that will help you so that we can have more providers in the world who can help youth transition. We have pretty good evidence that the more support young people have and the younger age at which they're able to feel comfortable with themselves, the better they're going to do long term. So the more people who will work with younger patients in transitioning, the better off the world is going to be.
It's okay to feel uncomfortable, but I just think we can't call ourselves healthcare providers and not be willing to talk about things that can have a huge impact on the health of our patients. It would be ridiculous if I were to say, like, yeah, I don't feel comfortable talking to my patients about their weight. That's a hard conversation to have, and frankly, it is. But the medical community would not find that acceptable, right? To say that there's this thing that I find hard to talk about, when it can have such a deep impact on the health of our patients. And I think sexual and reproductive health is the same way. That this is the stuff that really can impact our patients' futures, the trajectory of their lives, and to act like it's in any way okay to not talk about that stuff, I just think is a big mistake. It is awkward. It gets easier, and patients respond really well when, again, you ask about the stuff that is important to them and they may not be able to talk about with anybody else.
And I think the other thing with LGBTQ youth is for them to understand that they're in the driver's seat, not me. I'm just there as an assistant. I've got some information to help them with, but they're the one driving the bus, basically. And so I like to make that really clear.
I think all providers start with new patients with a little speech. Mine includes, if there's anything about yourself that you'd like to talk about, whether it has to do with your gender, your sexual orientation, your sexual behaviors, or anything else, please know that I won't judge you. I'm just here to help you. Let them know that you are someone that they can talk to. And obviously let them know that you'll keep the information confidential. And once you do promise that to them, honor that promise.
Don't want to get weird comments about my appearance. I would like to be able to feel like my concerns about my hormone regimen are taken seriously. Yeah. Those are my main things. No creepy comments, taken seriously. Made to feel safe. It would be some way to make me feel safe as a lesbian trans woman would be nice.
Something else that I always say is that when I'm asking these questions about the way that somebody is having sex, it's not because I'm nosy or I'm trying to get in their business. I think, when it comes to especially those more sensitive topics, really trying to find out what people's goals are. So, for example, whether a provider is providing transition care, like medical transition care or not, to really kind of explore with a patient kind of what is their goal, right? Like where are they trying to go? And even if as a provider, we don't necessarily have the training or experience to provide those medications or to do those surgeries, really kind of supporting and affirming that person in their journey and what they're hoping to be and how they're hoping to develop. I think that's huge. And so saying, good for you. You're interested in starting, hormones, for example. I can't provide that for you. I'm going to try to find a provider who can, but I want you to know that I think that's fantastic, and I'm so happy that you're starting this journey. Really, that type of like positive reinforcement, I think, it just means a lot, because again, they may not be getting that from anywhere else.
With LGBTQ youth, and especially on the genderqueer spectrum, or identifying as transgender, one day they might identify as female, the next day they might identify as male, and the next day they might identify as genderqueer, and you gotta go with that. And I think the other thing is calling them by the name that they prefer, using the pronouns that they prefer, and any other thing that they come in with it that is unique to them. And so it's not just about me using those names and pronouns correctly. It's about the front desk staff and the medical assistants, and so you've got to train the whole dang place to make it welcoming.
And it's really important to be sensitive about not asking questions that you don't really have any need to know the answer to. Someone's coming in for strep throat. I don't need to know anything about what surgeries they may or may not have had. Sometimes I think we ask questions to be compassionate or interested, but we're really asking out of our own curiosity. So that's worth a little bit of self-reflection. Do I really need to know this right in this moment in time? Or is it something that I'm curious about because I want to know? And if it's because as the provider, I'm curious, then that's a question I'm better off avoiding.
So to me, gatekeeping is when any clinician says, I won't do X for you until you do Y, or whatever. So all these permissions, just to get started on hormone therapy. So to me, that's gatekeeping. And gatekeeping means that in order for you to be who you want to be, you have to do these things, which is saying that you're not ready to be this person who you want to be until you do these things, as if these things over here are going to make you more ready to transition.
Especially for like getting the hormones, be aware of the informed consent, because I know like some places they have like these, oh, you have to do this for so long before we take you seriously. I feel like that time period should be spent actually trying out what you're trying to do. If you wait until this point, then you try it, it's just dragging it out. People get frustrated. But yeah, just do the informed consent, as even if it's just reasonable, even if like, because a lot of it is like insurance also. But if you can just, okay, this is how much, give realistic expectations, this is how much this is going to cost, if you're serious about this is what you need to do, have the referrals, I think it's more welcoming, and you'll see like a lot more, you'll see more repeat, more return on your clients, I guess you could say. Be aware of the pronouns, like especially when I call, I get like, so with the urologist, this is a referral. My doctor, she's good. That's one of the things I like her. She's good about letting people know about my identity before I get to where I'm going. And these people call, and they're still not taking that into account when they talk to me. So I end up having to correct them, and it's like, because when you correct somebody about it, you feel like, I don't want to say being aggressive, but you're coming off as perturbed. And it's not that I'm mad. I know why they're doing it, It's just that, but now like this is where we are. So we already have this like hostile sort of, or it's heading towards hostile interaction, And I just, it's hard. Because now I have to make all these I have to make these like judgments before I even come and see you. Am I going to have to correct you? Am I going to have to, how much are you going to take my issues seriously? Which I find that the ones who from jump when they're not respecting like the pronouns, and they're not showing that they understand that, this is an aspect of life that exists, when they, from that point where you talk to the front desk to the point you get to the back, you just know it's a downhill interaction. You're not gonna get anything solved. Nothing's gonna get done. You're not gonna get any answers. It's just as soon as you get in there, you're basically just checking the time, waiting for you to leave because it's so uncomfortable.
When I do make the mistake, and I invariably do, I apologize, but I try to apologize and move on in a way that I don't put it back on them to try to make me feel better about the mistake that I just made. It sounds hard, but it really isn't. You just kind of have to keep talking. Oh, Sam, I'm so sorry, I just misgendered you, but let's get back to what we were talking about, and that leaves Sam not needing to say, oh, it's okay, because in reality, it's not okay. But I think if I've developed any kind of relationship with Sam, they know that I didn't do it on purpose, and they're willing to forgive me for that mistake without having to, again, take responsibility and try to make me feel better about what I did.
There's lots of stuff about like mental health that's like just generally not talked about. An intersection with transness, like, I mean, there's like the fact that my these are not experiences I have, but I've like had my partner and also like friends who have, because of personality disorders or mood related disorders, or I have a friend who's autistic who was denied hormones because of people are denied hormones because they like have these like brain things going on, like, and there's this like complete like taking away of any like agency over one's like possible medical transition, like just because like different like mental illness stuff can like affect being trans doesn't mean that that's necessarily a bad thing or makes that person's gender any like less valid or anything.
Yeah, I think providers should leave the disclosure of sexuality and gender like to the patient.
Big one, especially for trans people, especially for friends I have, is not assuming that trans people don't need reproductive information. And the same thing with just queer people in general. Don't assume that they don't want or need reproductive health services. And then don't always assume that they're there for testing. That is something that's the first thing that I get asked every time I tell people, my doctor, that I'm gay. Are you here for testing? And very often that's not. And that's somewhat of an assumption, offensive assumption, in my opinion, to assume that we're always there for STI testing.
If I see someone towering over me, I could be potentially intimidated. There was a negative experience I had where the doctor was like very close, like right next to me, and like putting his arm over my shoulder, trying to be like buddy buddy, which I understand his intentions, but like ask before you like touch someone, because like I don't know, like you might think it's okay because you're a doctor, but like it's potentially not. Ask for consent for a lot of things before making any action.
First of all, I'd rather like my doctors not make comments about my personal appearance. Yeah, I don't know. Like, probably when I was like 6 months coming out and like just starting to wear like girl clothes regularly, like maybe that'd be all right. But you know, I've been doing this for a while now. I've been around the block a few times. I know, like, dude, I don't need like I do not need like weird compliments from my doctor that don't even make sense and definitely just feel like patronizing. Being asked like specifically, are you a lesbian, but like mixed in with a bunch of other stuff, like, so like, yeah, it's, like possibly being asked like what's my like orientation, which I guess that's not even like the most accurate way to like find out like who a person is having sex with, but like I don't know, like going like asking for the identity first and then like going from there would probably be best. Like or asking like, so what's your identity? Are you like gay or straight or bisexual or something else? And then like being given that opportunity to be like, hey, I like, hey, I'm a lesbian. Yeah, I guess that would be the best way to like comfortably ask me about that in a way that doesn't make me like panic and think like, oh God, should I lie?
To recognize that the way that my patients, for example, are treated by the police, or the way that they experience court or jail or prison, I just need to be aware of that, because that again is so outside of my own personal lived experience, and clearly has a big impact on their health and their relationships and the trajectory of their lives.
Welcoming. Be a human being. Admit when you don't know things. Create a relaxed environment that could help engender trust between the two parties. I mean, this is what you're looking to do with any patient that walks in the room.
My job as a provider is not to judge them or make them feel judged, or to in any way imply that they're not doing the very best that they can do at that moment. Because they are doing the very best that they can do at that moment. The lived experiences of our patients, their experiences with sexism, with racism, with homophobia, with economic injustice, with transphobia. I mean, there's just so many factors that can be at play as our patients move through the world. The idea that we can in any way like pass judgment on how they're surviving and getting through that, I just think it is a big mistake. And again, will kind of inhibit our ability to relate to them as people. And so I just think that's really important to keep in mind, that we will never know what it's like to be our patients, and all we can do is give them as much information as they want. Give them the information that they would need to make the healthy choices that maybe we think they should be making, and then support them in the choices that they are making, and just be here for them and support them on their own journey as they're moving towards whatever their version of health is. It's our job to be there for them. It's not our job to make them feel judged, or to feel like in any way that they're less valuable.
The LGBTQ youth and healthcare providers we heard from spoke about what cultural humility looks like in practice. This includes things such as patient-centered care, not making assumptions, understanding that each patient has their own unique experiences, practicing self-reflection, creating a welcoming and inclusive environment for LGBTQ youth, which includes using patients' self-identified name and pronouns, and respecting youth's autonomy. One final way to engage in cultural humility practices is to be aware of the many social determinants that impact the health of LGBTQ youth. From a cultural competency perspective, knowing myriad social determinants of health and how those impact health outcomes would enable healthcare practitioners to provide culturally competent care. From a cultural humility perspective, however, providers would also need to understand that social determinants do not affect all LGBTQ youth, nor do they impact each person in the same way. Providing culturally appropriate or culturally humble care requires that providers do not make assumptions about how social determinants affect LGBTQ youth, and instead talk to their patients about the impact of social determinants in their lives. Some social determinants that affect the lives and health of LGBTQ youth are racism, transphobia, homophobia, violence, housing instability, access to educational, economic, and job opportunities, access to LGBTQ-friendly services and programs, transportation, school environments and bullying, mental health, substance use, and social support. As we heard earlier, making assumptions about the experiences of LGBTQ youth can have a negative impact on the care they receive. Not taking into consideration how social determinants impact LGBTQ youth's health beliefs and behaviors can also be detrimental to their health and the quality of care they receive. It is important to talk with your LGBTQ patients about the factors in their lives that impact their health and meet them where they're at. Practicing culturally humble care with LGBTQ youth improves their health by increasing their access to affirming care while also strengthening the relationship between provider and patient. Thank you for taking the time to watch this webinar and for your vested interest in the health and well-being of LGBTQ youth. We would like to reiterate again that this webinar is only an introduction to working with LGBTQ youth, and we recommend looking at many of the other great resources on this topic that exist.